Hello everyone, welcome to our session on power training as an essential strategy for all older adults. I'll tell you a little bit kind of about myself, my background while we're letting some people file in here. I really appreciate you guys being here. My name is Dr. Cody Sipe. I am one of the co-founders of the Functional Aging Institute, and I also teach in a doctoral physical therapy program. I'm not a physical therapist, though. My background is in clinical exercise physiology. I got my master's in that. Then I went on to get my PhD in health sciences. But I've been working with older adults for over 20 years now, probably about 25 years, actually over that, in a variety of capacities. And after I got into my master's program, I really just really fell in love with working with older adults. And have really devoted, most of my professional life to really thinking about functional training and functional training strategies for adults of all functional abilities, healthy and unhealthy, with diseases, without. And that's kind of what we do at the Functional Aging Institute, is provide that sort of education. What really got me into power training was probably about the year 2000, early 2000s. When I really started to see some of the literature come out in the research world about the potential benefits of power training. And at the time, I was a heavy strength training type of person based on some of the research that had come out. Really was focused on battling sarcopenia, high load, 3 sets of 8 to 12 reps kind of approach. And the literature on power training really started to become more and more compelling and started to grow. In fact, I did my doctoral research project on a power training intervention with older adults. And it was about 2005. It was in 2005 that I did my first national presentation on power training and its benefits. And so I've been closely following the power training literature for the last 15 years. Or so, and really seeing it grow. And so today we're gonna walk through some of that literature, but I've tried in this presentation to go a little bit lighter on all of the research articles, systematic reviews, meta-analyses, and I'm only going to present really a few ones that I think are key, and spend a little bit more time talking through some of the things that they're referring to and that they're finding within the power training literature. So to start off is, when we think about older adults and we think about functionality, what we're really trying to prevent is this functional decline that we see occur in so many older adults that ultimately leads to disability, if they live long enough. And what can we do to prevent this sort of functional decline? We know that exercise is good for older adults. It's beneficial. In fact, it's such a powerful stimulus that almost exercise of any kind and movement of any kind is beneficial. But when we look at a lot of the guidelines related to exercise for older adults, what we see is really kind of a generic reflection of the literature, and what we see recommended for older adults isn't really any different than what we see recommended for younger adults. There might be a few, if, ands, or buts in there. If they have this, if they have this, if they have this, that you want to do some different things. But I think the research literature is really shedding much more light and giving us more insight into what is really going to be effective to prevent this functional decline, to reverse this functional decline in those that have it, and how we have to target our interventions based on where they currently are. If they're an independent person versus they're already going into frailty versus somebody that is already disabled, the interventions actually don't look exactly the same. But when we look at kind of what's happening in functional decline, most of the time, the conversation centers around muscle strength and muscle mass. It's centered, the conversation has kind of been there for a while now. And so we see, these sorts of things like the colorful images on the left. We talk about the typical declines, that we see in muscle mass and muscle strength as adults get older. It's usually just a very negative view, right? You're going to lose muscle mass. You're going to get a lot more fat, both under the skin, and also within the muscle itself that can impair, its functioning. But we can also look in the literature and we can see so many examples of older adults who have maintained their level of fitness and exercise habits, and therefore their muscles don't age and they don't waste away like we see in sedentary living. So most of the changes that we're seeing when it comes to muscle mass are really related to deconditioning versus aging. But a lot of the conversation has been around mass and strength for a long time. And we're seeing that conversation start to change a little bit. But really, this has led to a lot of people focusing on muscle strength as the primary intervention, or the primary target that we're going to go after with an intervention. So if you want to improve muscle strength, what are you going to do? Well, you're going to lift heavy, right? And I don't have any problem with people lifting heavy at any age. I don't want to hold people back from doing things that they love and goals, and to say, oh, just because you're 70 or 80, you can't lift heavy. Absolutely, that is not true. But what I do want to focus on is, well, what is the relationship of strength and strength enhancement to physical function, especially for those whose function is declining down into those levels of pre-frailty, frailty, and into disability, because those are obviously the individuals that we're most concerned about. And so a lot of programs, because the literature on strength training is very robust, we do see definitely benefits from the strength training literature for older adults, but a lot of focus then on, okay, let's lift heavy, and let's only lift heavy, and let's do that as the primary intervention. And so you see a lot of great memes out there on the internet and social media about this. A lot of deadlifting grannies that we get to see. So here's an 82-year-old granny deadlifting 153 pounds, and I think that's great. That's awesome. I think that is definitely beneficial. But let's really dive into the research related to strength and strength training for older adults. And let's just pick that apart for a few minutes and really kind of look at what's going on and what the evidence really shows. I think this is a great summation, a great visual to show when we're talking about individuals that are on the lower end of the functional spectrum. Where does strength fit in? Where does strength training fit in? And so you see, this is called the strength threshold. And what we see from this and other studies that support this are that when people are functionally limited, they likely have some deficits in strength. They very likely need to improve their strength because that's playing into their functional limitations, right? I mean, if you think about again, at the lower end of function, just getting out of a chair. Well, getting out of a chair is not too complicated of a task. It does require that you have adequate muscle strength in order to get out of that chair, right? That's kind of a basic component of being able to stand up. And so if you don't have enough lower extremity strength to get out of a chair, then yes, strengthening those lower extremities is definitely going to be valuable for that individual. It's going to help improve that functional task and also help improve other functional tasks, right? But as we kind of move up the functional spectrum, what we see is that once you have enough strength to easily get out of a chair, getting stronger and stronger and stronger isn't necessarily going to help you get out of the chair any more easier, right? So if you think about somebody who can squat 100 pounds versus somebody else that can squat 500 pounds, well, more than likely, the person that can squat 500 pounds can't get out of the chair any easier than the person that can squat 100 pounds. Yes, they're stronger, they can lift more load, okay, but is that going to help them with those functional tasks any more? And it's likely not, because both those individuals have exceeded that strength threshold. They have enough strength to perform those tasks. And so we're really most concerned about people having enough strength that are in this lower level of functional ability. Now, I would argue that strength training is good for everybody. It has numerous benefits. If you're going to do, very traditional, slow strength training, as like we've always done it, slow and controlled, that does have many, many benefits. We don't want to throw that out, but we want to layer that on and say, okay, well, in addition to the strength threshold, what's going on? And so as we look deeper into some of the evidence, especially the systematic reviews and meta-analyses that have looked at all these strength training interventions for lots of older adults of different functional abilities, what is the benefit of it from a functional standpoint? And so I'm going to summarize a lot of this evidence here. One, strength is definitely necessary, as I've said. But strength alone isn't sufficient to maximize function. Just because you have strength doesn't mean that you will be functional, right? It's a component that you need. So if you don't have strength, if you don't even have the basic amount of muscle strength, that's definitely going to impair your function, okay? But if you are strong enough, that also doesn't mean that you're going to be able to function really well. We also see in the literature that the variability in the impact of a progressive resistance training program is great within the older adult population. Now, if there's one word that we can use to describe older adults, it's definitely heterogeneous, right? I mean, they are extremely diverse in their capabilities, their health conditions, their comorbidities, their functional levels. I mean, you name it, it's all over the place. And so because of that, because of all those variabilities, progressive resistance training isn't going to benefit each individual the same way. It's those that are the weak, those that don't have enough, that are really deficit in their strength, are the ones that are likely to improve the most functionally from a progressive resistance training program, because they need to get up to that threshold. This is where the strength threshold comes in. But in addition, even for those individuals, we see that the specificity is still at play. And so strength training improves variables, functional variables or functional tasks that are most dependent upon strength. So getting out of a chair, I think we can easily see that that is beneficial for to have enough strength. Strength training is going to help them get out of a chair, because what do you need? You need strength. But when we look at other factors like balance as an example, in any sort of fall risk reduction program, we would include resistance training, okay? But just doing resistance training isn't necessarily going to dramatically improve a person's balance. It's not going to necessarily keep them from tripping or slipping, because balance has a lot of components or a lot of factors that feed into a person's ability to not fall, right? So strength is just one of many, many factors, and we've seen this over and over again. So because of specificity, we see that improving strength is really, from a functional standpoint, only going to improve the things that really rely on muscle strength. And when we look at why this is, when we kind of break this down a little bit more, this is the 6-domain model of physical function that we use at the Functional Aging Institute. If you're a clinician, if you're a therapist, you learn several types of systems approaches to function. There's multiple systems models that are out there that are utilized. This is similar to that, but it's broken down really primarily for fitness professionals and as a way to help to think about how these different areas play into physical function, but also understanding that all these areas also overlap, right? So when we think about balance, we can look at all the other 5 domains. Those all affect balance, and we know that. So underlying kind of these separations, we know that they are all connected and they kind of overlap to a certain degree. But we also want to understand that there's also kind of an isolated aspect to each of these as well. So when we think about specificity as an example, that's really important from a functional standpoint. And so we look at strength, and where strength is there in that musculoskeletal domain, okay, it is only one of many factors that feed into function. So individuals, because they are so heterogeneous, it is very, very possible that strength is not the issue. That's not the impairment that needs to be addressed for somebody in order to improve their functional ability. It very well could be something else. But people that don't have strength, that is definitely going to impair their functional ability as well. Now we look at power hanging off there, and we see that power is now a combination of speed and strength. So it really is taking in to account two variables at the same time, but lots of different factors go into determining a person's functional ability. When we think about power specifically, I think this is where this really got me intrigued into the power research to begin with, is that while we've been so focused on sarcopenia as being the loss of muscle mass and strength with advancing age, now we think about the loss of muscle power as well in that sarcopenic process, but we see leg power drops off earlier in life, and it drops off more quickly than does muscle strength. So while muscle strength is declining, and that's certainly a concern for many, many older adults, muscle power is also declining, and it's declining at a greater rate. Now, why is that? Well, it's of course because power is not just strength, it's strength and speed, it's strength and velocity. So muscle velocity, contractile velocity is also declining as we get older. It's just one of those factors that's affected by not just age, but also really deconditioning, by people not moving fast. So many older adults do not want to move fast. They don't ever intend to move fast or move quickly for a lot of reasons. Maybe it's because they don't feel like they can, or don't think they're athletic, they're not required to move quickly, or they could have poor balance, poor vision, and so they need to go slower while they're doing all these tasks. And of course, that further impacts their ability to move fast. If they're not moving fast, they're not going to be able to move fast as they get older because of deconditioning. When we look at how strength and power then relate to function, this is an older study. This was by Bean back in 2002. But I like the graph. It's nice and colorful. And also, this data has been upheld by other studies. So this is kind of an example of what we see in the literature across the board. And that is, when you look at the relationship of power to function, it towers over the relationship of strength to function, meaning power plays a much more important role in being able to perform many functional tasks than strength does. Strength is still important, right? You see those blue lines, the blue bars are not at zero. And it's because strength and power, of course, are related to one another. So it's never going to be one or the other. There's always going to be a relationship between all three. But you look at stair climbing time, chair stand time, even tandem gait, habitual gait, maximal gait. If you put it all together in a short physical performance battery, which is chair stand gait, and you see that power is much more closely related to functional ability across the board than strength is. So while we've been really focused on strength, there's been a lot of research to indicate that really maybe the culprit we need to be thinking about when it comes to function is power. Now, of course, these are just cross-sectional studies, so we need to be kind of careful of how far we take them. We need to have further evidence to show that, okay, power is something that is going to be valuable. So let's back up a second and let's just explore power for a quick minute, because this is going to really be important when we get into talking about recommendations for how do you do power training with older adults. When we talk about power training, a lot of people think about this, right? They think about power lifting, this huge snatch over the head of hundreds of pounds. What's really interesting though is that doesn't really create a lot of power. A shot put actually creates more power than this sort of heavy overhead snatch. The shot is much lighter, right? It's not near the weight, it's not near the load of a snatch, but because the velocity of movement is so much higher, ultimately the power generation is a lot higher in a shot put than compared to a snatch. So we have to consider that power has two components, right? It has the load or the strength or the force component, and it has the velocity or the speed component. And it's really just a combination of each of those that's ultimately going to determine power. But you can have high power at lower loads, and you have high power at a little bit higher loads. But we'll dive into that a little bit more later. What is also very interesting is some of the new evidence is coming out related to the contributions of the force side of the equation and the contributions of the velocity side of the equation. We're getting more insight into, well, is it equal for everybody? And again, older adults, of course, they're not going to be equal. They're going to be different in some way. This is by a study by Alcazar in 2018. And what it showed was they took older adults and they wanted to examine the force velocity relationship of a leg press exercise. And so they were going to measure the power, but then they were going to look at the contributions of force and velocity to developing power. And what they found is that it wasn't equal between individuals. And what really came out was that they found that some older adults were velocity deficit while others were force deficit when they had impaired muscle power. So when they test people and they say, okay, your power is low, right? Not all those people are going to need the same type of intervention. Those that are force deficit means I can move pretty quickly, but I really have a difficult time generating force. So those individuals may need to load higher and move slower because they can already move faster. But those people that are velocity deficit, it would be the opposite. They need to load low so that they can move fast because they can't move fast. So really interesting, I kind of look at this, and this is based, where they got this idea from was from looking at studies of younger subjects. And younger subjects, some other research groups had done force velocity profiling in younger groups and found that there were velocity deficit or force deficit individuals within those groups. Then they matched their, let's take a vertical jump training program as an example. They took those individuals and they either matched their velocity or force deficit programming, or they gave them a generic program that we would, don't worry about whether they're force deficit or velocity deficit. We're just going to give them a traditional generic jump training program, right, to try to improve vertical height performance. And what they found was the individuals that got matched with either being force or velocity deficit were the ones that improved the most in their vertical jump performance. So while we have not yet, I have not seen an intervention that matches power training and power training type to whether an older adult has a force or velocity deficit, it's very likely that we're going to see the same result, that matching the intervention to that individual is going to be what is most impactful on them improving their power, and likely most impactful for them improving their functional performance as well. And I'm pretty sure this same group is trying to do that. At least last time I spoke with them, they were trying to get a study, longer term study, in order to evaluate the matching of force velocity deficit. Now here's the thing. We don't really have the capability at this point in an average clinic or fitness center to do force velocity profiling. So it's limited kind of what we can do with this, but what I'm going to kind of just put a bookmark in this in your brain, because we're going to kind of come back to this idea a little bit later on when we talk about programming. Okay. Well, in 2012, there was a white paper that came out. Dale Avers, if you're in the PT world, you should know that name, was one of the co-authors on this. And what I liked about this was geared towards physical therapists. And so I love that even back in 2012, about 8 years ago, we see that already there was enough evidence to support, even in physical therapy, moving towards a power training paradigm instead of, or in addition to, a traditional strength training paradigm. Okay, and we'll look at, well, the instead of, or the in concert with, a little bit later on as well. And so the recommendation was, okay, let's get them up to doing a couple sets of exercise with good form, make sure they don't have any pain. And now let's really start to get them to move fast. And we can start with lower loads and move up to higher loads. But here's the thing, when you start with lower loads, you can move faster than you can move with higher loads. So you're really starting off with high speed training. And then as you load, you're going to start to decrease the speed of movement. One of the more recent reviews of the literature related to power and physical function older adults, they did a systematic review, but they were really also trying to make some very practical training recommendations, like what do we recommend for individuals in order to be able to perform these sorts of take advantage of the best power training paradigm. And here's the things that they found. They found that, look, maximal intended movement velocity was an important component. That is, you have to move as fast as you can, okay? Low training load, that actually using lower loads led to better outcomes. Simple training methods. That means you don't have to do anything fancy and complex. You can do isolated movements, you can do compound movements. We'll get to these movements later on, but even doing something like just a fast leg press or a fast leg extension can improve muscle power, and it can also improve physical function, which was what we're most concerned about. We don't care if their power improves if it doesn't improve something functionally, right? It's got to translate into real life. Low volume training and low frequency training. Again, very practical, simple things that show benefit to when doing a power training program. And that if you do those things, that it has a small to moderate advantage over doing slow movement training. So traditional strength training, slow and controlled. If you do fast, powerful, explosive training instead, that can lead to small to moderate advantages when it comes to improving physical function, okay? And to me, that's really important, because especially if you are a clinician, if you're a therapist, a small to moderate advantage is huge clinically, right? I mean, that can lead to drastically important improvements, because we know strength training is going to be beneficial. So if power training can be even more beneficial, that's really good evidence, especially when we look at these pragmatic type of recommendations, and we say we're not talking about high volume, high frequency, nothing complicated. We're talking about something that's very easy and very doable. And in fact, one of the things that they kind of summarized with in their systematic review that I really love, I say, look, when you consider all the evidence, the fact that muscle power is declining and that muscle power is really close related to function, and there's benefits over strength training of doing muscle power training, maybe that's what we should be targeting. Maybe when we talk about resistance training, we need to automatically be thinking power training, especially for older adults when we're trying to improve functional ability. And of course, to me, that's really always the key outcome, is improving functional ability. That's kind of the ultimate end goal, whether in therapy or in fitness, as an older adult, in my opinion. So if we really want to enhance function, we want to preserve function as people are getting older, let's focus on muscle power. So really great evidence to show that this is beneficial. In fact, when we look across the spectrum at all the different power training studies that have been conducted, many more that are being conducted, and I will tell you that there aren't nearly as many power training studies as strength training studies. Strength training has been studied in older adults for many more decades and ad nauseum. So lots of info on strength training. We still have a ways to go in power training from the volume of studies. We need more volume, a higher volume of studies. We need more detailed studies. We need longer studies. We need to start to separate some variables related to programming that I'll talk about later on. So we just don't have quite enough. But when we look across the board, we see that power training has been used very safely and effectively for a number of different outcomes and for lots of different populations. Okay. Now, I'm not saying for every population and every outcome it's every study is a slam dunk. This is a winner. But we've seen that time and time again across the board. It's safe and it's effective. And some of these populations are ones that we would typically almost shy away from using power training with. Look at osteoporosis as an example. We say, they've got osteoporosis. There's no way I'm doing any sort of power training movements with them. But yet, when you look at studies, even like the Lift More study, one of the kind of most highly touted studies related to bone mineral density using lifting in older women with osteoporosis, osteopenia, they actually had their women doing a jump pull-up exercise or a jump chin-up. So where there's a bar above you, and so you kind of grab the bar, but you jump to do a pull-up because, you know, most older women don't have the strength to do a pull-up. So you're going to jump up so your momentum can pull yourself above the bar, but then once you're there, you let go and you fall and you land, okay? And then you're in that impact is really beneficial for increasing bone mineral density. So they're having women jump and land who have osteoporosis, and they had 0 complications throughout the study related to those sorts of movements. And even in current recommendations related to that have capitalized on the evidence of studies like the Lift More study have said, look, progressing to power training could be really beneficial, because when you increase your speed of movement, you also increase the force, because you have to generate momentum, right? You have to overcome inertia. You're trying to generate momentum if you're using gravity-based equipment. And so there's actually additional force on your body during the early stages of the movement. So the same power training can be very beneficial. Osteoarthritis is another one. People say, oh my goodness, I would never do fast movements with my osteoarthritis patients, but we've seen time and time again in multiple studies that the individuals with osteoarthritis and studies that have targeted specifically those with osteoarthritis using power training, again, have shown it to be very safe, very effective, very feasible without any additional problems beyond what we see with typical strength training. And so when you look at, especially kind of across the range of function, this is the hierarchy of functional aging that we've created. If you're familiar with the hierarchy of physical function that Dr. Wanning-Sperduso published recently back in 1995, this is an expanded hierarchy based on that model. And so it's designed to break down these functional categories a little bit more into smaller chunks, which is very important when it comes to programming, choosing assessments, that sort of thing. And again, what we see is power training has really been shown to be safe and effective across every single functional category. Now, of course, if you're up in the elite and the fit categories, you're probably doing power training at a higher level. You're doing it for different reasons. You know, you're doing it for performance, you know, sport performance, whatever. Whereas if you're down in the frail and pre-frail categories, power training is going to look a little bit different, but it's just because we've scaled it to be appropriate for that level of function. And that's what's really important. It's not, should we do power training or should we not do power training? It's how are we going to do our power training? And so we just have to be able to scale the movements appropriately, depending on the functional level of the individual, and of course on any special considerations that they might have. So what about those lower levels of function? That's what I started off with, right? Hey, we're trying to prevent people from declining down into disability. So what about those frail and pre-frail individuals? Like, aren't they just, like, if we do power training with them, aren't they going to break? You know, aren't they going to fall apart? They're going to hurt themselves? Well, there's been several research groups that have been very instrumental in investigating a number of power training type of interventions for these frail and even dependent individuals. And they've shown, again, that it is extremely beneficial for these frail individuals to perform power training, and it is probably more beneficial that they perform power training than traditional strength training. Again, we go back to looking at the decline of power, its relationship to function, but what we're seeing in a lot of these studies is that there's an added advantage functionally from performing power training compared to performing strength training, and it's not dangerous for individuals. So there's a good rationale for including these explosive movements with frail individuals, the ones that are declining and at the most kind of risky functional place. Those are the ones that we really need to target with power training. Their recommendations, this is from Izquierdo and Cador in 2014, one, focus on lower body power, right? That makes sense. The lower body is what's responsible for mobility, right? Getting out of a chair, climbing stairs, gait pattern, falls, everything. It should be focused much more on the lower body than on any other part of the body. We can use a normal velocity of training at first to get people to used to the movement. This is very similar to what Dale Avers, was recommending. Let's get them used to the movement first, make sure they can do the movement, and then we're going to increase speed. And we don't even have to go as fast as you can at first, but we are going to get to as fast as you can on the concentric portions, and then slow and controlled on the eccentric portions. So for example, if you're having a frail individual, let's say they can get out of their chair, but you're going to try to get them to explode up out of their chair as fast as they can, and then to slowly sit back down in the chair. That would be the eccentric part of the motion. Kind of reset and do it again. We've also seen from the literature that a wide variety of equipment and programming is being used with these individuals. And so you can use machines, absolutely. You can get people doing, leg press, leg extension, leg curls. That's all good. But also doing more functionally based activities with body weight, with weights, with balls, with tubing. All of these can be used effectively. Again, as long as we are scaling the movements and the movement strategies to the functional level of the individual. It's like you've got so many options to choose from. It isn't just one thing that you can do. So, whether you're clinic or your fitness center or you're in somebody's home, wherever you are, you should be able to perform some really beneficial high velocity explosive movements. Now, they also go into a little bit about, how all these things fit together related to power, and how power is kind of that linchpin between what we're looking from kind of muscle atrophy and also the kind of the central and peripheral nervous system related to these tasks, and how beneficial it is, and how that can then move people from frailty more towards being independent. So the same researchers, Cador and Izquierdo, came out with another study and recommendation in 2018, and they actually have several publications that I really appreciate. One of their studies or articles that I didn't include actually is a little editorial, and they said, look, we should not avoid explosive movements in the frail elderly. We have to use explosive movements in the frail elderly. I mean, that's how strong the literature is showing the benefit of it. And again, that's a group where we typically look at and we say, explosive movements, I'm not seeing it. Well, let me tell you, explosive for them might not look too explosive, and it might not be explosive for you, but the idea is that they are trying to be explosive. They are trying to contract at their maximal intended movement velocity, right? They're trying to be explosive, okay? So when we look at even the physically frail, oldest old, this is shown to be beneficial, and it's shown to be safe. And we can do it by itself, or we can combine it with traditional resistance training, either one. The loading can vary quite a bit. In fact, I would say lower loading so that people can move faster is probably going to be more beneficial. There are a number of other studies that are just indicating that lower loading might have an advantage over higher loading when it comes to function, and especially different aspects of function. Some of these studies we need more research on, and they haven't been replicated in many times. In fact, there was a really interesting study that I loved by Orr. Gosh, I can't even remember when it was published. I think it was published before 2010. But they looked at high, medium, and low load power training with older adults that had functional problems. And one of the outcomes they looked at was balance. They did a computerized balance test and created a balance score for these individuals. The only group to improve their balance score, and it improved significantly, was the low load group. Okay, the medium load and the high load power training group did not improve their balance, even though the medium load and high load groups improved their strength the most. The low load group improved their balance and improved their functional tasks more than the other two groups, right? So in that case, loading lower so that you can move faster was more beneficial. There have been a number of other studies that have looked at this loading scheme and have, at least in my opinion, I'm starting to see it that the literature is suggesting more and more, maybe low load is what we want, but we'll talk about loading here, soon. Any type of load, again, can be used, doesn't matter what you're loading. And they really wanted to make this as kind of across the board as possible. Look, you can do it in a hospital room. You can do it in a geriatric residence facility like a nursing home, right? And when you're doing it, because when you're doing power training, especially if you're doing low load power training, that you can actually do power training maybe twice a day. Like, you don't have to just do it once, but when you're using that low load power training, it is not the same as high load strength training. High load strength training really, in essence, breaks down the muscle, correct? The skeletal muscle tissue to try to get that muscle to rebuild, to lay down more protein. And so there's a repair process. So strength training on Monday, you're not going to strength train on Tuesday. You might strength train on Wednesday or even Thursday, right? You're not going to do 2 days in a row. But with power training, the research is suggesting you could probably do it even multiple times a day and it still be okay, because you're not creating that same myofibrillar kind of breakdown that we see with traditional resistance training. And I bolded kind of the end result of their recommendation: optimizing functional ability gains, reducing fall incidents. It does improve muscle strength. It also improves muscle power, and it improves muscle power more than muscle strength training does. So if you think about traditional strength training, you improve your force, you're going to improve your power a little bit, right? Because power is force and velocity. But when you're doing power training, you're improving both sides of the equation, force and velocity. And depending on your loading, if you do light loading, you're going to improve the velocity side more, but power is going to really be maximized with power training. And it does stimulate muscle hypertrophy. That's also one of the kind of myths related to power training, is that, well, your muscles aren't going to get bigger, but you do stimulate muscle hypertrophy even in older adults. And of course, as we know with older adults, it is difficult to really induce a lot of significant muscle mass gains, but we do see them occurring with strength training and with power training as well. So I've already kind of touched on a number of different power training programming variables. So I want to kind of put it all together and talk through kind of some of the options, and then we'll look at exercise movements specifically that you can utilize. So one, equipment. There's a lot of different equipment that can be used. Pneumatic equipment would be like the Kaiser strength training equipment. It's what I have in my lab. We actually have that in our fitness facility. I really love the Kaiser equipment. It is pneumatic equipment that is computer controlled. And what I mean by that is, if you set the load to, let's say, 50 pounds, then when you perform that movement, it's 50 pounds almost throughout the whole movement, right? And no matter how fast you go, the load stays at 50 pounds. And of course, we know when you use something like a gravity-based equipment, you get more loading at the beginning. When you're trying to accelerate, you get less loading at the end of the motion. Pneumatic equipment doesn't do that. So it's very smooth. It's great for older adults. It's actually two of the groups that's probably the best for using the Kaiser stuff is either an athlete or an older adult, like two kind of ends of the spectrum. Now, if you were talking about an older adult athlete, and that's even better. But you don't have to have that type of equipment. If you have it available, it's definitely awesome to use. But a number of studies have actually used resistance bands, elastic-based resistance, body weight, any sort of dumbbell, kettlebell, barbell, weight vest, medicine ball, It really doesn't even matter what you use. You just got to scale the movement again to the person's capabilities and what you have, as a resource. And so I think that's very valuable. When we talk about the concentric part being as fast as possible, that's for the individual to determine, and you want to try to encourage them to move as fast as possible. Obviously, what you have to be concerned about, and as we'll look at some of these movements, is if I'm doing a standing movement, and I'm trying to do something as fast as possible, I have to be concerned about falling, right? And balance becomes a risk. So you might have to constrain them in certain ways, and so that they can move as fast as possible and feel safe. Because if they don't feel safe, they feel like they're going to fall, they're not going to move as fast as possible, right? That just doesn't make sense. So you want to try to put them into situations where they can really be explosive. And then you have to kind of teach them what that means. And so working their speed up, using really low load, even no load whatsoever, can be very valuable. And, when we're talking about kind of the loading thing, well, we'll jump into that in a minute as far as load. You then want to have the eccentric part slow and controlled. And that's a 2 to 3 second kind of slow and controlled part. So that's very kind of standard for traditional strength training. The exception to that is for like a counter movement jump. And I kind of put the counter movement jump exception in the wrong place. It should be with the eccentric. When you do a counter movement jump, right, you're going down into a squat very fast so that you can take advantage of the stretch shortening cycle, and you're going to go down fast and then you're going to explode up. Okay. So when you get to the point where an individual is able to do a counter movement jump, then you want to go down explosively and come up explosively. So that would be one example of an exception. And you'd say, well, I would never have, my people do that. Well, I'll change your mind on that in a minute. But also, even if you look at the Fullerton Advanced Balance Scale, which is a balance scale that's a little bit harder than the Berg Balance Scale. So the Berg Balance Scale is pretty low functioning. People max out on it if they're, decently independent at all. But so then you put them through the Fullerton Advanced Balance Scale, and one of the tasks on that is to try to jump with both feet the length of 2 feet. So if you measure your foot and your foot's 12 inches, you'd see, can the person jump 2 feet? Can they jump 24 inches? Okay. But the slow and controlled part on the eccentric is really important, especially if you're using machines and a lot of these other movements, because what you don't want, and this happens all the time when you're trying to teach people how to do power training, even on a machine. So I kind of, since I'm up in a chest press, I'll show you, so that you can see me at least a little bit, is, if I explode out, I want to slowly come back, and it's kind of like reloading the gun, kind of recocking the spring, and then I can explode out again, and I can focus on the explosion. If I come back really fast, then I just start to be all herky-jerky around, right? That's going to lead to a lot of movement error, a lot of inaccuracy, and they're going to become unstable, even in their trunk or whatever they're doing, and it's going to become really a disaster for everybody. It's going to put them at increased risk. So you don't want them to do that. You want them to focus on the explosion, stop, reload slowly, and then focus on the next explosion. That way you can get the most out of them and it'll be safe. So I already mentioned loads being about 30 to 60% 1RM. There's good indication to show you could go lighter than that, but I'm going to stick with Izquierdo and Cador's recommendations right now as it related to frail older adults. The sets and reps, this is where we need a lot more research. Most of the studies on power training have defaulted to doing a traditional strength training program, and that is 1 to 3 sets of 8 to 12 reps. But what we see when we look at the power training over rep ranges is that you can't maintain a high power load beyond about 6 to 8 reps. So what happens is, like, you do your first rep and you're fresh and you have good power, and you do another rep and it's got good power, right? And you're measuring the power, and you get to rep 4 and it starts to drop off, and rep 5 starts to drop off, rep 6, right? You cannot continue maximal power because of kind of the fatigue that starts to set in, even at lower loads. So there's a number of people that are saying, well, man, what if less is more when it comes to power training? What if we did, 6 reps so that we can be really explosive and then rest and then come back again when we have almost like a CNS refresher, right? My nervous system is refreshed again. It's relaxed. Now I can do it again. And to that end, one of the studies looked at cluster sets. And what they did is they compared groups who did 8 reps all in a row, like you would normally do, versus a cluster set in which they would do 2 reps, then they wait 30 seconds. And they do 2 reps again, and then they'd wait 30 seconds. And so they would do that 4 times to get their 8 reps in, and then they would take a normal between set rest of, I can't remember how long it was, longer than 30 seconds. And so basically it's the less is more ideas. Let me be as fast as I can for 2 reps, and then let me relax and let me recover so I can be as fast as I can the next time. And what they found was the cluster set training actually led to better improvements in function in older adults. So we don't know all of the programming kind of specifics that we need at this point. And like I said, when we think back to some people are force deficit versus velocity deficit, how does that fit in? There's a lot of variables that we're not quite sure about. 2 to 5 times a week, of course, that depends on load and depends on kind of the person and the goals they're after. So some of the recommendations that we've already seen from these systematic reviews are a low frequency program works. But yet, if you're working with people in institutionalized setting, inpatient care, that sort of thing, you could actually do it multiple times a day to try to get more of a benefit for them as they're kind of going through their healing process and their transition process, coming off of illness, injury, surgery, etc. And what we see, of course, in those situations is that early intervention is best, to not allow the deconditioning to accelerate while they're laid up in the hospital. And so doing power training, I think, is a really great intervention in that situation. So lower whole body focus, of course, is important. And then take into consideration their specific needs like balance and other things that we'll talk about a little bit. So looking at the high and low intensity aspect when it comes to power training, this is from 2019, very fresh, systematic review that was jumping into trying to look at the different loading patterns. Again, this is more, to me, more ammunition to say, why don't we load low? Because when they compared low, moderate, and heavy loads, they all worked. They all improved function. And so if they all improve function, why would I not load lighter? One of the reasons that we might want to load lighter, one of the advantages of loading lighter, and again, this has been seen in the research studies, is that when you load light, it feels easy. It actually feels easy for people. Even though they are moving as fast as they can, they do a set and they're like, well, that was relatively easy. Yeah, because you're using 30% of your 1RM compared to 60 or 70% of your 1RM. So the perception for the user is that it's easier and I don't feel as tired. And of course, then I don't have as much muscle specific recovery as doing high loading. So there's a number of advantages to doing the low loading. And I think the continued research is going to have to focus on the loading patterns a little bit more, in addition to the kind of exercise prescription patterns that we see related to sets, reps, frequency, and that sort of thing. So when we think about programming load, we look at the 30 to 60% that's already been recommended. When we kind of put that on a force velocity curve, that kind of hits that speed strength area. Right? We really want to think about the speed of things much more than the load of what we're doing. But when we look at high load is going to have lower velocity. When I say low velocity, I mean you're still trying to move as fast as possible. You're still doing power training, but because it's a higher load, you just can't move as fast, right? So we want to use that when we really want to focus on strength as a primary variable. So if we want to get kind of the best of both worlds between traditional strength training and power training, we do higher load power training, because that's going to look more like strength training, but it's still going to have the explosive component. When we then kind of move down the scale to low load, high velocity training, okay, it's perceived as easier. It might even be better for chronic conditions because the loading is so much lighter. And we've seen that in some of the kind of the orthopedic type studies. It also may be better for balance, as I referred to earlier. Again, there's got to be more research into this. So again, these aren't slam dunks. But you know that you can even do no load whatsoever, and that'll give you the max velocity that you possibly can get. You're going to maximize speed. You're not going to have very much force generation. Really interesting study out of the University of Arkansas, that they put older individuals on either a power training program on the machines or a movement matched program not on the machines, where they're just using their bodies. So what I mean by that is, again, let's take the chest press example. I'm on a machine chest press and I've got a load and I'm doing explosive chest press movements. The no load group sat in a chair, got in a chest press position with nothing in their hands, and just mimicked the chest press being explosive in the chest press. And wouldn't you believe it, the no load group improved functionally just as much as the loaded group did. So again, that's one study. I haven't seen any other studies that have done absolutely no load like that, but there's something to be said for that neuromuscular component of just, I'm trying to move as fast as possible, trying to get the speed up rather than worrying about force generation and how that might impact functional ability. So just something to kind of think about here. So when we think about this from a perspective of, okay, there's some good evidence for kind of low load, high velocity stuff, but the strength is also a variable that we're concerned about. So we might want to mix it with some strength training or traditional strength training. Well, how about just using a mix of loads in your power training? Whether that's going to be a variability from session to session or within one session, maybe you're doing, even on the same movement, a higher load movement and a lower load, high velocity movement, or set, I should say, and you're mixing it up that way. I don't know. Like I said, there's a lot more that needs to be done in this area. So let's get down to some of the movements, and I classify the movements in these 4 categories, and this is something that other people have kind of done as well, looking at lifts, throws, and jumps for traditional power movements for athletes. But I also put in starts and stops for older adults, and I think those are very beneficial for this population from a number of different perspectives. So let's look at some of these power exercise movements. And what I've done is I put some in that have varying levels. So kind of looking at what are people that are frail and pre-frail, what could they do? What if I'm looking at kind of lower to higher independent folks? Of course, we always want to progressively move people up the functional spectrum. So as people improve, what can I transition to? Obviously, you have to consider the individual. You want them to be challenged for sure, but you want them to be safe. And you want to make sure that, like I said, with balance, if they're too worried about balance, they're not going to give you good effort on speed. So looking at the frail and pre-frail group, again, you can do machines like leg press, leg extension, leg curl. You can do it with ankle weights or bands, same movements. But now we get into things like power stands, power chair stands. So you're trying to explode up out of the chair. I mean, when you think about it, if you do a 5-time sit to stand test or a 30-second chair stand test, those kind of all correlate back to muscle strength, but isn't that power, right? I am trying to stand up as fast as I can. That's a power movement. Sometimes the test is the exercise and the exercise is the test, but trying to get them to explode up as fast as they possibly can and then sit down more slowly. Mini hops, just trying to get them in a standing position so they're not going to squat all the way down like you would in a jump, but it literally is kind of like a little bunny hop where you just kind of squat down just a little bit and you just try to, can I even get up on my toes? Can I even get off my feet? And that's where you could have, somebody there for balance. You can have them hold on to something for balance so that they can focus on trying to, can I even move explosively? That kind of goes back to even doing the power stands, because you have people that maybe they can't get out of their chair. So how can you introduce power if they can't even get out of the chair? Well, how about, can they even get their bottom off the seat? My friend calls it the spark, but can I put them in a position where they can just kind of get up, right? Really just drive those feet into the ground, push yourself up to the ceiling, and you know you're going to fall back in the chair, but you're trying to initiate the power movement for them. What if I even actually unweighted them? What if I put a band, okay, connected to something above them, coming around them, and saying, okay, what if I unload them? What can I do to kind of help them? And that's going to actually help them stand up out of the chair as fast. Okay. Clock or bug stomps. So bug stomps is something that I really like to do. You just literally, in a standing position, have them imagine there's bugs on the floor. We do this as a fall prevention, kind of what to do if I'm falling, reaction, and you just say, you got to stomp on the bugs. So they've got a weight shift and really powerfully stomp on those bugs. And you want them to not tap their toe. You want them to really stomp and shift weight onto that foot. They can do it forward, sideways, angles, different lengths, again, depending on their functional abilities. You want to give them a little something to hold on to for balance, to help them. That's good. Step ups, stair climbing, the get up and go test, like the 8-foot up and go is a good one. Or you could do the tug, but make it for as fast as you can. So they're trying to get up out of the chair and they're trying to get moving as fast as they can. Chair drills. This is one that Dr. Joseph Signorelli has mentioned and used. He's down in Florida, and I really like this. I kind of just adapted this from him, in which you could take a chair facing one direction, another chair, facing another direction, as an example. And the person has to stand up out of this chair and very quickly walk over to this chair and sit down, and then stand up and move back over to this chair and sit down and stand up. And you can, of course, do multiple chairs in different directions and areas. So it's a little bit more advanced 8-foot up and go type of exercise. Red light, green light, that's the game that everybody loves to play as kids. Green light, how quickly can they take off from a standing position, walk as fast as they can, and you say red light, and they've got to stop as fast as they can. Okay? And what you want, of course, is you want to see a quick takeoff. Can they accelerate? And then you want to see them stop very quickly, not stumble into it. And that's going to work on decelerative power, right? There's kind of that eccentric power component that's important. So some of these other ones I kind of won't go into down there, but these are all ways to just get people to try to move fast. We're trying to do fast as you can. So even marching, how can they march as fast as they can? Can they sidestep as fast as they can? Trying to get them to move quickly. And then we can move up to looking at the power stands. People that are lower, higher independent can do those as well. Keep doing those. That's something that really works well for a broad range of people. But then also moving from some of the hops into more jumps. Can they get off the floor, just like in that FABS test? And maybe that's a vertical jump. Maybe that's a little bit more of a forward jump or a broad jump. You can then use line hops as part of that as well. So you just have a line on the ground. Can they hop over the line? Can they hop backwards over the line? Can they hop to the right over the line? Can they hop to the left over the line? Okay. Again, really just trying to get them to generate a good amount of power. For people that are now moving into kind of independent categories, you can even introduce things like sprints, really short sprints, kind of takeoffs. It's kind of like that red light, green light. You don't have to have them stop quickly, but just kind of, okay, go. And they take off as fast as they can. If they can run, let them run, right? What time is it? It's just a clock stepping drill where you say, okay, imagine you're in the middle of a clock face. You have 12 o'clock in front of you, 6 behind, all the other numbers, and you as the trainer or the therapist would call it a number. So you say 2 o'clock. Well, then I'm going to step and weight shift to 2 o'clock, or maybe I'm going to lunge to 2 o'clock, whatever their capabilities are. But I'm trying to get out there, and I'm trying to get back to standing as fast as I can. And as soon as they're back to standing, you're calling out another number. So you're trying to be rapid to make them move as fast as they can. There's some cognitive skill to this. There's reaction time to this. processing speed, but ultimately you're trying to get them to move as fast as they can. And so the step out and then pushing back as powerfully as they can to get back up to standing quickly is part of the power. Jumping jacks, even wall balls, fast feet, agility ladder, kicks, punches, all of these are really appropriate. So we can scale lots of different types of exercises. What we don't really want to do here is, from a power perspective, we don't want to add in things like obstacles right now necessarily. We don't want to add in unstable surfaces. If you have people standing on foam pads and trying to do jumps, it's the unstable surface diminishes your force development. It diminishes your ability to generate power. So you really want just normal, stable, hard floor conditions for these types of movements. That's really the most beneficial. So you see people like this guy, he is going to be doing a 30-inch box jump. He happens to be 73 years old doing a 30-inch box jump. And people will often say, what, plyometrics? Why would I ever do plyometrics with an older adult, right? Older adults should never do plyometrics. Well, that's just ageist. It really is. Now, I'm not saying you should do plyometrics with all your older clients or try to get them to do 30-inch box jumps like this guy. But when you watch his form, great load, great explode, soft landing. He does this really, really well. Gosh, he does this probably better than I can do right now, to be honest with you, okay? Now, that doesn't mean he has to go up to 36-inch and then 40-inch and then 50-inch, but for a 73-year-old to be able to do this 30-inch box jump, that's looking good for his future, isn't it? I mean, that's really nice power that's going to help with his functional ability as he gets older. And in fact, a meta-analysis from 2018 looked at jump training interventions in older adults. Now, they included studies that had adults over 50, but the vast majority of studies had average ages in 60s and 70s, most of them in their 70s. And they found, look, only one reported adverse event out of all these studies. Jump training was effective, but it was more effective when you did more than one exercise, you did more than 2 sets per exercise, more than 3 jumps per set, and more than 25 jumps per session. So, and there were a lot of different functional levels that were included across these studies. So jump training, don't be scared of it. If you can take somebody who's frail and get them to the point where they can get off the ground and land, wow, that's really a big improvement. That's going to translate into really good functional ability for that individual, no doubt about it. So as a therapist, as a physical therapist, how do you introduce power training? How do you start to make that transition? I think for many fitness professionals, it's kind of easy to do that because you've got, you don't have any parameters. You don't have anything holding you back. You can just kind of do it. But from a physical therapy standpoint, I know it's not the norm. Your patients, it might be new to them, and it might be new to you. So how do you do that? Well, here's what I'm going to just make some very quick recommendations. Is just start by adding one unloaded high velocity set to the current strength training routine you're doing with people. If you're having them to do typical leg extensions, I'm just going to say that with some sort of load, take off the load, have them sit in a chair on the edge of a treatment table and just do explosive leg extensions. Just one set, just getting that integrated, seeing how they respond. If they're doing chair stands, just end with one set of explosive chair stands, Then you can kind of move into more mixing it up. Do half slow sets, half of the sets that are slow at a normal load and half of the sets fast at a lighter load. Just start mixing power training in, or into your session, choose 2 or 3 speed or power movements to add in. I just threw some in here as examples to kind of fill some space, but just choose something that you think would be appropriate for that older adult patient and just do it. Just introduce it and see how they respond. You're going to learn, they're going to get used to it. But to be honest, I think this is the paradigm that we need to be following when we are thinking about strength training or any sort of loaded training for our older adults, whether it's in therapy, whether it's in fitness, whether they're frail, whether they're fit. We need to start changing our mindset to high velocity, explosive, high, high movement speed type of training, trying to get these people to move as fast as possible. All right, well, I hope this has been beneficial. I'm going to kind of hang on for a few minutes. We've got just a few minutes at the end. If you guys have any questions that you would like to ask, why don't you put them into the chat panel, and I'll be happy to answer those. I'll tell you, we've got a number of resources related to power training that I think would be beneficial for you in our membership site. We've got, oh man, just hundreds and hundreds of videos. I've done presentations on power training, going to different aspects of power training that would be very beneficial for you if you want to learn that. We actually just put up a new course it's called Rapid Movement Training, and Paul Holbrook, who does a great job at a facility in Salt Lake City, he does a lot of work with speed training with older adults. Now he uses it with his athletes that are older, but he also uses it just with everybody that's older, and that's a great course that you could that could kind of deepen your knowledge and understanding of doing some of these high velocity speed power training movements and techniques with your clients and with your patients. If you want to reach out to me, feel free to reach out at contact@functionalaginginstitute.com. Like I said, I really appreciate you guys being here and taking a part of this summit and everything that we're doing. So if you have any further questions, please reach out to me. I'm not seeing any in the chat right now, so be happy to answer those if you like. So you guys take care. Really appreciate you being here.